My name is John Lane. I'm happy to share with you a few details about physical therapy from a physical therapist perspective or focus. Some of the characteristics carry over to a physical therapist assistant, but I'd take too much time describing both occupations. The profession of physical therapy is rehabilitation focused, along with occupational therapy and speech therapy. It originated in World War I as a rehabilitation aid and has developed a lot over time to become nearly autonomous as a healthcare profession. The requirements for admission to a program have been similar over the last 30 years, a combination of many science-focused classes and several hours of experience in different physical therapy settings, whether volunteer or paid experiences. Like medical school, physical therapy school is focused on generalist preparation. Developing your understanding of the human body and evaluating for performance changes is the primary focus, while learning how to address or treat the differences or problems is more accomplished after you finish school. Unlike medical school, there are only a few residency programs out there. Typically, these are delayed while you get a foundation of experience. And I'll talk about specialization a few minutes from now. There are really two healthcare systems in general terms: the federal system, which is the VA, military, or Indian Health Services, and the non-federal system, which is comprised of many insurance companies in different settings. I'll touch on how these two systems impact your administrative experience. The salary range really is affected by where you work, by setting, by state, and by experience. So you could be making around $66,000 as a new graduate, maybe a little more, a little less, depending on the state. And as you gain experience, or if you become like a practice owner or a department supervisor, you can make as much as $124,000 or $125,000. Now, there are different settings that you can work in as a physical therapist. These three categories are really kind of the classics. And so if you're in an inpatient or acute care, meaning you're within a facility where somebody's been admitted, like for surgery or after a significant injury or like a stroke, you see them for a few days. Or if you're working in long-term rehabilitation, you could be working with them daily for up to a couple months. Or you could be in an outpatient setting, which is what most people think of with either orthopedic injuries or sports medicine or like pediatric programs. Depending on where you're at, will determine how long you're working with somebody and how your focus is by time frame. So if you are in an inpatient or acute setting, then you are trying to make things happen within a couple days because the patient needs to leave the facility, whether it's to go home or to go to a rehab center, is really something that you will make a real influence on in that as you see what's safe and what they cannot do for themselves. In long-term rehabilitation, you'll be working with individuals on a daily basis because they're literally staying at a facility to get care. It may be acute rehabilitation or it may be long-term care facilities, more like the nursing home setting. In outpatient, again, people often think of with orthopedics, they're going to be coming there because they are able to literally go to you. So it's higher function care. Depending on your staffing, you will determine how many people you'd see on a given day or how often you would see them. So who do you work with? Your experiences in any work setting are often determined by who you work with. Well, if you're, again, in inpatient or acute care, you'd work with physicians or possibly residents, nurses, likely occupational therapy as, again, another rehabilitation service. Again, you get to see rapid changes, but you really don't see the end results. With long-term rehabilitation, you'll, again, get to work with doctors, nurses, acting with doctors, not to do nursing, but just oversee care. Working with occupational therapists, speech therapists, others who are, again, helping people recover function in different areas of concern. So you will have a series of interactions with a given patient. So again, because they're not safe to return home yet, whether it's neurologic injury or because of significant injuries like after a serious car accident, then they'll work with you until they can return to home. And then they move over to the outpatient side. So your interactions with outpatient settings will be indirect as far as the referral sources, physicians or otherwise. Maybe phone calls, it may be written correspondence, may simply be a written prescription. You may or may not have assisting staff. So you might work with athletic trainers, you might work with physical therapist assistants, you may work with aides, or it may just be you and the patient, depending on your setting. And again, that will affect how often you're seeing them. If you're the only one, then you'll see them a couple times a week. If you're working with support staff, you may only see them for a few minutes on a given day, or you may only see them every few weeks. As a physical therapist, there are multiple areas of specialization. You really wouldn't sit for examination or focus on these until a few years into practice. You can't get certified for at least 3 to 5 years, depending on the area. But these are the different categories, if you will, depending on the population, because of age or by what they are dealing with. The last one listed, clinical electrophysiology, is a specialist who has additional training on providing tests to give feedback on where injury happened along the nervous system. So it's more of a specialist of a technique than really just the type of patients you see. So what makes you a good fit for physical therapy, or makes a physical therapy a good fit for you? Well, depending on what you like to do, if you are a problem solver and you like to still work with people, then this could be a very good field for you, because you will gain experience and effectiveness, so your appreciation for your work will increase, and your patients will increase in their appreciation for what you do. Whether you're a new grad or very experienced, they will appreciate what you offer for them as they see the benefits as they go. You can look for and find patterns. You will see, regardless of which setting you have, some things fairly often. So you can look for things that seem to show up often, or you can look for what's unique about each given patient. Now, on the more challenging side, unless you're really looking for administration, healthcare is a business. Insurance programs and what they cover and what they require from you for documentation to get any reimbursement really does affect how your boss will see your productivity or reimbursement, and really does affect your experience. Depending on what state you work in will affect your autonomy, or can you see somebody off the street, or do you need to have a referral from a provider? And it can really affect what you're allowed to do with that patient as treatment techniques go. Providers may only want you doing certain things, and insurance guidelines may only offer you certain things, even if the state allows for it. Now, the federal system's different in that you will have emphasis on access, getting people in, and being very good at doing what you do, because you have a lot of people to see. And so you can have a lot of visits, but you're expected to see a lot of different people. But what you're allowed to do goes with you state to state. That is nice. You can work in different workplace settings. You could work in primary care offices. You can work in emergency rooms. You might work in a health club or a gym if you're on the wellness side, but you do need direct access for that. You could work at people's homes because they're homebound, or they just want to see you at their home if they're comfortable with that. Or you can move from place to place. There are a lot of different opportunities. So I've shown you the classics, and I've shown you where you could go if you're interested in this field. I hope this helps. Have a good day.